So I have been here all day. I think I've seen, I don't know, maybe 12 people, and probably 4 or 5 of the people had kind of very similar conditions. This is the spring. Every spring and fall, I tend to get a certain problem that comes up again and again and again. It involves your neck, and most people will come into my office and they'll say, you know, I must have slept funny. I can't really move my neck. It hurts when I turn it in one direction. You know, it's hard to shoulder check when I drive. A lot of you, even just describing that, you probably are familiar with what I'm talking about. So when you have a subluxation in your neck, it affects the nerves. Those nerves control the muscles, particularly in this case, your trapezius muscle, and sometimes this muscle right here called your sternocleidomastoid. Interestingly, both of those muscles are also involved in stress. So when people are really stressed out, these muscles get very tight. So for some reason in the spring and fall, it seems to be the difference between heat and cold that triggers it. So most people come in the morning, in the night, they had one side warm against the pillow, one side open to the cold air. And you'll see it's kind of weird temperature today or this time of year. The radiant heat kind of heats your house. So the furnace turns off, and then the temperature of the house drops when the sun goes down, and then it takes a little while for the house to heat up again, but you get that cold air. So if you're having this problem right now because of the situation we're in, I'm kind of only supposed to be seeing the people that are kind of in that 7 to 10 range of pain. You're really quite acute. You're having trouble with mobility. If you're an essential worker, you know, make sure you're getting in so you can do your job. But there's a few little things you can do. So this is a horrible kind of pain, and if you've had it, you know what I'm talking about. So little bits of range of motion. You'll notice when you have it, you can turn your head up to a point, and then it starts to hurt, and it just gets exponentially worse when you go past a certain point. There's no benefit to going past that point, so don't bother. But just do the range of motion, go up to pain, and hold it there for 8 seconds, 10 seconds. Go the other way, 8 to 10 seconds. Chin down, all the way up, and then ear to your shoulder. And be careful with the ear to your shoulder one, because if you think of what the bones are doing, they're coming down right on that irritated nerve. So go through those ranges of motion periodically throughout the day. Stay very well hydrated. Dehydration makes everything worse. And try to wear, you know, if you're wearing a hoodie, zip it right up to your neck, wear a scarf. Make sure you're not right under a draft. You know, you want to keep your neck a nice uniform temperature. And if you do have any problems, please feel free to give me a call. I'm mostly bored here in an empty office all day, so I'm totally happy to talk to people at any given time of the day. So if you have any questions or any problems, please feel free to give me a call, and I hope you guys are all doing well. Take care.